The night shift nurse who nobody remembered. That was Laura Bennett, moving through Mercy General's corridors at 11:41 p.m. like someone who had learned the art of being invisible. She didn't walk fast enough to draw attention, didn't make eye contact in the break room, didn't speak up in morning briefings unless directly questioned. The other nurses had stopped inviting her to happy hours around month 3. The doctors barely registered her presence at all. She was competent, efficient enough that her patients' rooms stayed organized, medications arrived on time, dressing changes happened without fuss, but competence in nursing, she had learned, was a quality that rewarded you by being left alone. The fluorescent lights hummed overhead in a frequency that would drive most people mad. Laura had stopped hearing it around 2008. Antiseptic and old coffee and something underneath that, sweat, human breakdown, the smell of a place where bodies failed on a schedule. She moved into room 407 where Mr. Harrison sat upright in the adjustable bed, his left arm extended for the restart he'd been needing for 6 hours. The previous nurse had tried twice. Blown veins. Now the sight was bruising dark as a plum. "Good evening, Mr. Harrison," Laura said, her voice carrying no apology, no urgency. Just statement. She pulled on nitrile gloves with a snap that would have made her corpsman nod in approval. The sterile field went down, alcohol prep, gauze, the tourniquet positioned exactly 3 inches above the antecubital fossa. Her eyes tracked the median cubital vein, the one that should have been obvious the first 2 times if anyone had looked carefully. She didn't need to look carefully. Her hands already knew. The needle went in. Smooth. Flash of blood in the chamber, bright red, oxygen-rich, exactly what it should be. She threaded the catheter with a motion that came from somewhere deeper than conscious thought, somewhere that remembered field hospitals and triage protocols and the specific angle required to find a vein in a patient who had lost 30% of their circulating volume. Tape down. Connection made. The saline flush ran clear. Done in 90 seconds. "There we are," she said quietly, disposing of the needle into the sharps container with a soft clink of glass. Mr. Harrison exhaled, relief visible in the softening of his shoulders. "That should hold you until morning." She was washing her hands when she first saw him. Dr. Sterling stood in the doorway of room 407, observing. Not the kind of observation that looked casual. His eyes had tracked every movement, the tourniquet placement, the angle of insertion, the absence of hesitation. He was a tall man with the kind of posture that came from knowing people generally stepped aside when you moved. His suit was charcoal, expensive enough that the weave showed quality. A surgical tie. Hair graying at the temples in a way he probably considered distinguished. He didn't say anything. Just nodded once and moved on down the corridor. But something in that nod had weight to it. Laura didn't follow. She finished charting, updated Mr. Harrison's medication log, and continued her shift with the same methodical precision that had gotten her through 18 years of nursing across 2 civilian hospitals and the thing before that, the thing she never talked about, the thing that lived in the lining of her jacket like a tumor that might metastasize if she acknowledged it too carefully. It was 2:14 a.m. when she found the anomalies. The supply order reports were supposed to be routine midnight review, checking inventory against what had actually been used on the surgical floors. Laura pulled up the database in the break room, the only place quiet enough to think, and started cross-referencing. Post-operative dressing kits. Standard order per hospital procurement was 1 unit per surgical patient. Mercy General processed roughly 40 surgical cases per day. 40 kits. Simple math. But the order showed 127 units billed to Medicare for the previous month. 3 times the usage rate. The cardiac stents were worse, ordered in quantities that made no clinical sense, billed at prices that climbed incrementally over 6 weeks like someone was testing to see when the system would flag the cost. Kickback fraud. Clean and simple and prosecutable. Someone was ordering supplies at inflated rates, the surplus being billed to insurance, the difference disappearing into accounts that wouldn't stand up to audit. She should have reported it. That was what protocol required. That was what any nurse with a clear conscience would have done. There was a compliance hotline. Anonymous. Protected. She knew the number from orientation briefing, had the laminate card in her pocket. She didn't call it. Instead, she closed the database, set her coffee mug in the sink, and continued her shift. Her military training had taught her that invisibility had value. Information was only dangerous if you wielded it. Knowledge was only a weapon if you demonstrated that you possessed it. The smartest play was to see nothing, say nothing, let the machine operate as it would. Senior Chief Petty Officer Laura Bennett had spent 17 years learning that survival came from being the quiet one in the room, the one whose name nobody could quite remember, the one who could disappear into background noise the way other people breathed. The evening dissolved into routine. Vital signs every 2 hours. For checks at 3:22 a.m. and for 24 a.m. A medication adjustment for Mrs. Chen in room for 12 who had been nauseated since post-op, bedpan assist for the elderly gentleman in 408. The work was endless and repetitive and exactly what she needed, the kind of work that let her brain go quiet, that let her move through the hospital like a ghost moving through walls. It was 5:16 a.m. when Dr. Sterling appeared again. This time he was in the medication preparation room, watching her draw up a syringe of pain medication for Mr. Harrison. Her hands were steady. The syringe went from the vial to the pre-filled label to the sealed bag with the precision of someone who had done this 10,000 times before. Which she had. He was leaning against the counter in that way that suggested he was blocking an exit, testing to see if she would acknowledge him. She didn't. She simply set the medication in the medication cart and moved toward the door. "Senior Chief," he said. The words landed like a bell ringing in a silent church. Laura stopped. Her hand was still on the cart handle. Her breath did something complicated in her chest, a compression and release that came from muscle memory, from recognition, from the specific tone of voice that came from someone who had just connected a set of facts that were never supposed to be connected. She turned. Her face was blank. That was the skill, really, the ability to look directly at someone while showing them absolutely nothing. "Doctor?" "Interesting technique," he said, his eyes never leaving her face. "For a floor nurse." Laura didn't flinch. Flinching would have been an admission. Instead, she met his gaze the way she had learned to meet the gaze of superior officers, with deference as armor, with compliance as invisibility. "Just following protocol, Dr. Sterling." He smiled. "Predatory. Like a wolf showing its teeth before it bit down." "Yes," he said slowly, as if tasting the word. "Of course. Protocol." He moved away then, stepping aside to let her pass, his presence retreating down the corridor like a tide pulling back before the storm surge. Laura continued to the patient rooms without changing her pace, without letting her breathing change. The medication cart rolled smoothly beneath her hands. Her limp was barely visible this time. But in the pocket of her scrubs, her left hand found the rough fabric of what was sewn into the lining of her jacket, the faded unit patch, the cloth she had stitched there 18 years ago as a reminder. She touched it the way some people touched a rosary. Not prayer. Just recognition. Dr. Sterling went directly to his office. Laura didn't know this yet, but she would know it soon. He pulled her personnel file from the digital system, the one with the employment gap that stretched from 2006 to 2023. 17 years that simply weren't there, replaced with a notation, military service, details classified per request. Her references were vague. Her previous address was a P.O. box in Norfolk, Virginia. There was no LinkedIn profile, no public social media, nothing that would give him the specifics of what she had been before she became the quiet floor nurse nobody remembered. But he knew what her hands could do. And he was beginning to understand that knowing something was far more dangerous than being ignorant. Room for 12 smelled like antiseptic and fear. Laura Bennett adjusted the 4-line on Mr. Harrison's left wrist, her hands moving with a kind of precision that came from years of working in places where improvisation meant infection, meant amputation, meant death. The 70-year-old's tremor was pronounced, essential tremor, documented in his chart, and the standard 18-degree angle would have infiltrated within an hour. She angled it lower, compensating for the shake. Her fingers were steady. Everything about her was steady. Dr. Sterling entered without knocking. "Nurse Bennett." His voice came like a tank idling in a garage, low and menacing. "That for angle is completely improper. Did you even complete your competency training, or did they just hand you a license?" Mrs. Harrison's hand gripped her husband's shoulder. The monitor beeped its steady rhythm. Laura took one measured breath, her eyes still on the peripheral line. "The angle accounts for his tremor, doctor. Standard protocol would infiltrate within the hour." Sterling's face reddened. He moved closer to the bed, his presence making the air pressure change. "Don't lecture me on protocol, floor nurse. Fix it properly or I'll document your incompetence." She said nothing. Pulled the 4. Started again. 18 degrees exactly, the textbook angle, the one that would fail. Mrs. Harrison's eyes filled with tears watching the exchange, and that small detail, the wife's trembling jaw, told Laura everything she needed to know about what was really happening. Sterling wasn't here because of the 4. He was here because she knew. Because he knew that she knew. Because silence could be more dangerous than speech. The next morning, Laura walked into the break room at 6:57 a.m., 3 minutes before her shift started. She'd brought the same lunch she brought every day: turkey sandwich, apple, black coffee. She sat at her corner table, the one by the window that overlooked the parking garage. Within 90 seconds, Nurse Patricia gathered her tablet and stood. "Forgot to check the supply order," she said, though she'd just sat down. Nurse Miguel suddenly remembered a patient callback. Even Chen, who'd nodded hello every morning for 8 months, turned and left without meeting her eyes. One muttered as she passed, "Can't sit with someone under review." Laura unwrapped her sandwich. Took a bite. The turkey was dry. Everything tasted like nothing. Then she saw it. The unit board mounted on the wall beside the refrigerator, positioned at eye level where every staff member would see it every shift. The paper was laminated. Professional. Damning. RN Bennett, failure to follow 4 protocol, corrective action required. Not a private conversation. Not a coaching memo filed away. A public notice. A scarlet letter. The kind of document that made colleagues keep distance, that made patients nervous, that transformed you from competent to suspect in the eyes of everyone who read it. Laura looked at the board for 7 seconds. Then she folded her sandwich wrapper, threw it away, and walked out. She didn't eat the rest. She clocked in at 7:01 and went to work. The afternoon shift brought 3 post-op patients and 1 acute admission, a 63-year-old with pneumonia who needed chest imaging and 4 antibiotics. Laura worked the cases without speaking unless spoken to. Her hands moved with the terrifying fluid precision of someone who'd trained in rooms where hesitation got people killed. Every stick was a single attempt. Every assessment was clinical and exact. She caught a medication error on the 1400 order, a dose that was 3 times the weight-adjusted standard for the patient's renal function, and brought it quietly to the RN checking it. The response was a tight nod and nothing else. Dr. Sterling found her at the medication cart at 2:47 p.m. "You know what I call nurses who think they're smarter than doctors?" He blocked the aisle with his body, his expensive watch catching the fluorescent light, a $12,000 Omega Seamaster, the kind of thing that telegraphed privilege to anyone paying attention. "Unemployed. Better brush up that resume, Bennett the liability." The medication cart was narrow. The aisle was narrow. There was no way around him that didn't mean showing deference or asking permission. Laura stood still. 3 nurses were within earshot, pretending to organize supply bins. The hallway monitoring camera was positioned at the far corner, its lens angled away from this precise spot. He'd chosen this location deliberately. She wiped away a single tear without breaking eye contact. It was the first show of emotion anyone had seen from her in 2 days, and Sterling's smile widened because he thought he'd broken something. "I've worked with surgeons in conditions you couldn't imagine, doctor." Her voice was quiet. Controlled. "I know the difference between confidence and cruelty." Sterling's expression flickered, just a fraction of a second, before he turned and walked away, but that flicker was important. That flicker meant he hadn't expected her to answer. Hadn't expected her to use the word cruelty. Hadn't expected her composure to hold. That evening, while restocking the surgical supply closet on the 3rd floor, Laura noticed something that made her pause. The cardiac stent orders. She'd seen them before. A Mercy General performed roughly 42 cardiac cath procedures per month, about 10 requiring stent placement. That meant the hospital needed maybe 120 stents per quarter. Standard inventory management. The order forms in front of her showed 486 stents billed to Medicare in the past 45 days. The hospital's procedure volume was documented in the surgical database, 43 stents actually placed. The math didn't balance. The numbers didn't exist in the world except on paper. Post-surgical kits were billed at 3 times the contracted rate. Percutaneous devices were duplicated on invoices. There was a pattern here, a deliberate pattern, quantities that didn't match actual usage. Someone was padding bills. Someone was collecting payments for procedures and devices never implanted. Someone was making money from that gap. Laura photographed 3 order forms with her phone. Her hands were steady. The camera click was barely audible. She filed the forms back and closed the closet door, knowing this made her more vulnerable, not less. That the only version of this story that ended safely was the version where she disappeared again, where she went back to being invisible. But that wasn't the worst part. That night, her phone rang at 9:14 p.m. Mercy General HR. They needed her to provide additional credentialing documentation by end of week. Military records, background verification, employment gaps clarified. Standard protocol, they said. Nothing to worry about, they said. Laura sat on her kitchen counter in the dark, her phone pressed to her ear, listening to explanations she wasn't going to accept. The patch inside her jacket lining, the faded Navy hospital corpsman insignia she couldn't quite discard, suddenly felt like lead. That patch represented 12 years and 473 days of service, 3 tours, 2 Purple Hearts, a Bronze Star with Valor, and 17 months of nightmares she'd finally started to sleep through. It represented Ramadi. 2006, the aid station on Anbar Street. The mortars. The faces. She couldn't provide those records. Not without explaining. Not without revealing. Sterling had moved from public humiliation to strategic escalation. He'd made phone calls. He'd filed complaints. He'd triggered background checks. He was building documentation, creating a paper trail, constructing a case that would prove she'd misrepresented her credentials, that she'd lied on her hire, that she was a liability the hospital needed to remove. And the irony was exquisite and terrible, the very skills that made her dangerous to him, the trauma medicine, the command presence under pressure, the ability to read a coded patient and know what to do before anyone else in the room, were the reason she could never use them here. Using them would reveal her. Revealing her meant losing everything again. At 3:01 a.m., Laura sat at her kitchen table with a blank page and her hands trembling for the first time in 48 hours. She began typing a resignation letter. Due to unforeseen personal circumstances, I am requesting to withdraw my employment at Mercy General effective immediately. I apologize for the short notice. Just disappear again. Find another hospital, another city, another name. She'd done it before. She could do it again. The letter was 3 paragraphs. Professional. Clean. The kind of message that left no trace and asked no questions. She never sent it. The code blue alarm sliced through Mercy General's ICU like a blade through silk. High-pitched, mechanical, demanding. Laura heard it from the medication station and moved before her conscious mind caught up. Muscle memory took over, the kind that came from years of hearing that sound mean someone's heart had stopped doing its job. Trauma Bay 3. Petty Officer Marcus Webb, 28 years old, Navy SEAL, admitted 6 hours earlier from a training accident that nobody had explained and she knew better than to ask about. A fall from 30 feet. Blunt force trauma to the chest. The kind of injury that looked fine on initial assessment and then decided to kill you when nobody was watching. Laura pushed through the ICU doors and into controlled chaos. The monitor screamed its flatline frequency. Nurses were already running, compressions underway, crash cart positioned, defibrillator pads applied to Webb's bare chest. His pressure was gone. His oxygen was gone. The only thing keeping him alive right now was the mechanical thump-thump-thump of hands on his sternum, forcing blood through vessels that had forgotten how to do it themselves. Dr. Sterling stood at the head of the bed, his tailored shirt already darkening with sweat at the collar. He was barking orders with the authority of someone who'd never had those orders questioned, his voice carrying the particular tone of a man who mistook volume for competence. Continue compressions. Charge to 200. Draw labs. Get me an EKG. The cardiac surgeon was 20 minutes out. Maybe more. Traffic on I-25 was unpredictable at this hour, and the pager had gone out to Dr. Hartley at home, which meant gown, drive, enter through the ER bay. 20 minutes translated to cardiac death in this kind of situation. Laura stood in the corner, watching, and something in her chest tightened. The jugular veins in Webb's neck were distended like they were being strangled from inside. His chest rise and fall wasn't balanced, the left side was lagging, compressed, like someone had wrapped a belt around his ribcage and pulled tight. The heart sounds she could almost hear from here were muffled, distant, as if the heart itself was drowning. Beck's triad. Distended neck veins. Muffled heart sounds. Hypertension. Her hands knew it before her voice did. He needs pericardiocentesis, Laura said quietly from the corner. Now. Dr. Sterling didn't even turn around. That's not your call, floor nurse. We have a surgeon coming. 60 seconds, she said. The numbers came out flat, statement of fact. His pressure's dropping faster than fluid. He's got blood in the pericardial sac crushing his heart. 60 seconds and you're doing CPR on a corpse. Sterling's jaw clenched. He was the kind of man who experienced correction like a physical blow, and correction from a floor nurse, in front of his team, in front of the patient's family if they could see through the glass, was intolerable. Compressions continue. Charge to 300. The monitor showed 40 systolic and falling. Webb's brother was standing in the doorway. Jake Webb, early 30s, built like something carved from granite, with the particular stillness of someone trained to watch and wait and then move with violent precision. Combat medic, 75th Ranger Regiment, according to the chart Laura had pulled up in the 3 seconds she had before the code started. His eyes were locked on his brother's face, then flicking to the monitor, then back to his brother's face. A loop of helplessness. Laura looked at the crash cart. The pericardiocentesis kit was right there, sealed in its package, the 18-gauge needle inside waiting for hands that knew what they were doing. The kind of procedure that required precision and confidence and the ability to feel tissue resistance through your fingertips while aiming for a target you couldn't actually see. The kind of procedure that Senior Chief Petty Officer Laura Bennett had performed 17 times in a field hospital in Ramadi under mortar fire, with one hand holding plasma bags and the other guiding the needle toward the pericardium. Her hands moved before Sterling could stop her. The kit opened with a soft snap of plastic. Alcohol swab across the subxiphoid space, below the ribs where the needle could slip between them and up into the pericardial sac. Her left hand found the angle, natural as breathing, muscle memory written into bone and sinew during 1,000 training hours and those 17 actual saves that meant the difference between a Marine walking home and a flag folded into a triangle. The needle angled toward the left shoulder, entry point precise, the kind of precision that came from knowing exactly what you were doing. The team around the bed had stopped talking. Even Sterling had gone quiet. The needle slid through skin and tissue with a slight resistance, and then the give. The moment when the needle tip broke through the pericardial membrane and entered the space where blood was pooling like a weight around Webb's heart. Laura's thumb eased the plunger back. Dark red blood filled the syringe. 80 cubic centimeters of pressure releasing, fluid draining, the weight lifting off the muscle that had been strangled for too long. Webb's monitor responded before she'd even finished drawing back. The pressure jumped. 60 to 65. Then 70. The rhythm started to organize itself, the flat line finding the peaks and valleys of something resembling normal sinus rhythm. The oxygen saturation began climbing from the low 60s. 68, 72, 78. The room was so quiet you could hear the ventilator's rhythmic wheeze, the tick of the wall clock, the faint percussion of rain starting to hit the ICU windows. Jake Webb pushed off the door frame. He crossed the room in 3 strides and stood beside the crash cart, his eyes moving from Webb's face to Laura's hands to the syringe still draining fluid from his brother's chest. When he spoke, his voice was barely a whisper, pulled from somewhere deep, a voice Laura recognized because she'd worn the same tone once, years ago, when she'd seen something impossible become real. "Only fleet surgeons and senior corpsmen needle that clean," he said. "Where did you serve?" Laura didn't answer. The silence between them held the weight of classified things, of scars that weren't visible, of rank structures that didn't exist in civilian hospitals where she'd spent the last 18 months trying to forget she'd ever been anything but a floor nurse. She finished drawing the final syringe. The pressure was stable now. Webb's monitor showed a steady rhythm, 92 beats per minute, oxygen climbing toward 95. She set the syringe down on the crash cart without turning to face Jake Webb. Dr. Sterling's voice cut through the moment like a scalpel. "What in God's name do you think you're doing?" She turned then and met his eyes. His face had the particular shade of purple that came from rage so complete it interfered with blood flow. His hands were clenched at his sides. He was looking at her the way a predator looks at prey that had just revealed fangs. "You just committed a felony in front of 12 witnesses," he said. His voice was quiet now, which was worse than shouting. Quiet meant strategy. Quiet meant he was already calculating. Practicing medicine without a license. Operating outside your scope of practice. "I'm calling security." His pressure was 40 systolic, "Doctor," Laura said. The words came out steady, emotionless, a statement of facts for the record. He was 80 seconds from cardiac arrest. "The syringe is right there if you want to verify the pericardial fluid. I don't care if you just performed open-heart surgery with a butter knife," Sterling said. "Security. Now." Laura had made her choice the moment her hands moved toward that kit. She knew what came next. She'd always known. The moment she stopped being invisible was the moment she became expendable, and Sterling was already calculating how to make her disappear. She pulled off her gloves. Dropped them in the sharps container. The small clink of latex hitting the bottom of the container sounded very loud. Jake Webb was still watching her, and in his eyes was the particular knowledge of someone who'd spent years around people carrying secrets that would disqualify them from everything the world thought they deserved. Webb's monitor continued its steady rhythm. The crisis had passed. The seal was alive because a floor nurse had remembered how her hands were supposed to move when someone's heart stopped. Everything else, the career she'd tried to build in anonymity, the years of careful invisibility, the faded unit patch sewn inside her jacket lining that she'd kept as a reminder of what she'd survived, everything else was about to burn. Security arrived in 45 seconds. 2 uniforms, professional and impersonal, waiting by the trauma bay entrance. Sterling's voice followed Laura as she walked toward them, his words cutting through the ICU like shrapnel. "You're suspended effective immediately pending investigation for unlicensed medical practice. You'll surrender your badge at the main entrance and have no further access to Mercy General pending the outcome of the disciplinary review." Laura didn't look back at Webb. Didn't look at Jake Webb or the monitor or the pericardiocentesis kit she'd just used to save a SEAL's life in front of everyone who mattered. She walked toward the security guards with her chin level and her eyes forward, and in her chest was a hollow kind of certainty, the knowledge that she'd just set something in motion that couldn't be stopped. Webb's monitor beeped its steady rhythm behind her as she left. Dr. Sterling's hands moved before his mind caught up. He was already dialing board member Harrison at 2:13 a.m., the phone pressed against his ear in the dark of his office, his voice steady and controlled and full of the kind of urgency that made powerful men listen. "We have a situation," he said, not preamble, just fact. The Bennett nurse performed an unauthorized procedure on the SEAL patient. Cardiac tamponade drainage. She has no credentials for that level of intervention. I need this flagged for immediate termination on scope of practice violation. Harrison, who owed Sterling 3 high-revenue cardiothoracic referrals and a hunting trip to Vale, didn't ask questions. I'll call emergency session for tomorrow morning, Harrison said. Get documentation. Sterling was already moving, another call to his device rep at Medtronic, panic bleeding through now, voice like a tank idling in a garage. She's been in the supply closets. She knows about the orders. We need her gone before she connects anything to the kickback structure. Then the next call, to the outside HR investigator he kept on retainer for exactly these situations, a woman named Patricia Chen who had built a career on fabricating professional misconduct cases that held just enough plausibility to survive initial scrutiny. I need a termination file, Sterling said. Unauthorized procedure. Practicing medicine without a license. She touched a cardiac patient with a needle. That's your angle. Chen arrived at Mercy General at 8:15 a.m. in a navy blazer that matched her smile, which was sharp and had nothing to do with warmth. She moved through the hospital with the precision of a woman who had dismantled 17 nursing careers, conducting interviews in the break room, asking staff, has Ms. Bennett ever performed procedures outside her scope, and did anyone see her use equipment without authorization, and the most damaging question of all, were you aware she has no credentials in advanced procedures? Most nurses said nothing. One, a travel nurse named Jessica who'd been reassigned 3 times by Sterling, said quietly, I saw her place that central line on the SEAL. It was the most perfect line I've ever seen. She didn't hesitate. Her hands were. Jessica trailed off, understanding the trap too late. Chen wrote, witness states defendant demonstrated advanced technical capability inconsistent with RN credentials, suggests unauthorized medical training or practice. Laura didn't defend herself. She sat in the small HR office on the 3rd floor of Mercy General at 3:22 p.m. on the day after the SEAL's code, facing Chen and Sterling and 2 board members she'd never seen before, and when they showed her the suspension notice, unauthorized performance of advanced cardiac procedures in violation of Nursing Practice Act, she didn't argue. She couldn't. Any defense would require explaining where a floor nurse learned to perform emergency pericardiocentesis with surgical precision, and that explanation lived in 18 years of classified medical training, in combat zones that didn't exist on civilian paperwork, in a senior chief rank that would burn everything she'd spent 2 years building at Mercy General. Sterling watched her face, waiting for tears or anger or the kind of desperate pleading that made these moments satisfying. What he got instead was nothing. Laura's jaw tightened once, a single muscle contracting at the hinge, and then her face went neutral in a way that made the temperature in the room drop. I understand, she said, and those were the only words she spoke. She removed her badge from her scrub pocket, the ID photo showing a woman with exhausted eyes and no history, and set it on the table with a soft click of plastic on wood. She walked out past the nurse's station without looking at anyone, past the medication room where she'd discovered Sterling's fraudulent supply orders, past the break room where she'd eaten lunch alone for 2 years. The ER doors parted with a whisper, and she was gone. The suspension became official termination 72 hours later, a letter delivered to her apartment in the Highlands, a 1-bedroom place with carefully blank walls and a kitchen she never used. Laura had spent those 3 days not sleeping, her PTSD erupting like a pressure valve finally released, night terrors in which she was back in the Ramadi aid station, mortar fire turning the walls to dust, the smell of copper and antiseptic triggering muscle memory that made her bolt upright at 3 a.m. gasping. She'd stopped answering her phone. She'd stopped pretending she was okay. On the 72nd hour, she drove to the Denver VA hospital in Capitol Hill, parked in a visitor spot, and walked through the waiting room like a woman moving through water. The chairs were filled with the architecture of war, a man in his 60s with a prosthetic left leg, a younger veteran with the 1,000-yard stare that came from IED blasts, a woman in a wheelchair with scars mapping up her right arm. Laura recognized them the way other veterans did, not by sight but by the particular weight they carried, by the way they sat, by the medications written on the intake forms they were filling out. This was her people. This was what she'd been running from. She took a clipboard. The intake form asked if she'd ever experienced combat-related trauma. Her hand shook holding the pen. She checked the box marked yes. The doors to the emergency bay opened at 3:51 p.m. Orderlies wheeled in a patient on a gurney, a man in his late 40s with the color of someone whose liver was failing, jaundiced, swollen, his breathing labored. Ascites. End-stage cirrhosis. The paramedics called out vitals as they moved, BP 88/52, GCS 11, respiratory distress, admitted from the street. Laura watched the orderlies pass, watched the emergency team mobilize, and then the patient's eyes found hers. His eyes locked on Laura's face with the unmistakable weight of recognition, the kind of moment where the past stops being past and becomes suddenly, terrifyingly present. He was older than she remembered, smaller, decimated by disease and the kind of life that follows survival from gunshot wounds. But his eyes were the same. She knew him. She'd treated him in Ramadi 18 years ago. He'd been 15 years old, wounded by American fire in a raid that went wrong, bleeding out in the courtyard of a mosque. And she'd saved him anyway. His voice came raw from his throat, speaking in Arabic to the interpreter who'd appeared at the stretcher, his words tumbling out with the urgency of a man who knew his liver was killing him at roughly 120 beats per minute. That woman. That woman there. Ramadi. 2006, the American senior chief who held the aid station when it was shelled. I was 15. American bullets. She treated me. She put her body between me and the shrapnel when the mortars came in. She was hit. I remember blood on her leg. She didn't stop working. The interpreter looked at Laura, then at the patient, processing the impossible probability. Around the waiting room, other veterans' heads had turned. They knew. They could smell the truth the way predators smell blood in the water. Laura's hands trembled as she stood, as she pulled her jacket tighter, as she reached inside the lining where she'd sewn the faded unit patch 18 years ago, the cloth from her Ramadi tour, the one she touched at 3 a.m. when the memories were loudest, the one she'd kept hidden from everyone at Mercy General because uniforms and patches and insignia were triggers waiting to detonate. The patch was olive drab cotton with embroidered gold thread, *SEAL Team 3, Charlie Platoon, FOB Ramadi Star. Her hands weren't steady, and she didn't bother hiding it anymore. The patch felt like evidence. Like confession. Like everything she tried to bury was finally being excavated, and there was no hole deep enough to hide it. The interpreter's voice came quietly, cutting through the ambient noise of the waiting room. Is this true, Were you there? Laura looked at the man on the stretcher, Ahmed. She remembered suddenly, his name was Ahmed, and then at the interpreter, and then at the other veterans in the waiting room who were all watching her now with the particular intensity that came from recognizing a shadow of their own past. She opened her mouth. She closed it. She couldn't speak, but she didn't have to. The patch in her trembling hand said everything. Within 48 hours, 50 troops appeared at Mercy General's administrative entrance in dress uniforms that caught the morning light like polished steel. Navy SEALs, Marines, Army Rangers, sailors, the kind of presence that made security guards straighten their spines and hospital administrators remember why they joined healthcare in the first place. They moved with the terrifying fluid precision of apex predators pretending to be human. The SEAL commander led them, his face carved from granite and purpose, his shoulders broad enough to carry the weight of classified missions and the names of men who didn't come home. Dr. Sterling was in the hallway when he saw them. His coffee cup froze midway to his lips. The color drained from his face like someone had pulled a plug. The SEAL commander walked past Sterling sputtering objections. This is highly irregular, you can't just, and pushed directly into the boardroom without knocking. 50 troops lined the hallways like sentinels. The fluorescent lights hummed overhead, and for once, they sounded like a warning. Laura was in the staff break room when Captain Jake Webb found her. He stood in the doorway with his dress uniform sharp enough to cut, his voice steady as a surgical laser. They're asking for you. Boardroom. Now. She didn't move. 12 years of training had taught her that moving was how you got targeted. Silence was survival. Invisibility was armor. Senior Chief. Now. That word, senior chief, spoken with the particular deference reserved for someone who'd held rank in the Brotherhood. It shattered something in her chest. She stood. Her hands were steady. Her breathing controlled. This was the composure that had kept her alive in Ramadi, and it would keep her alive now. The boardroom fell silent when she walked in. 50 uniforms turned. The SEAL commander's eyes found hers and held them with the weight of recognition. Behind him stood his teenage daughter, Emily, her face streaked with tears and rage. Senior Chief Bennett saved my father's life. Emily's voice shook like wind through a canyon. When his heart stopped. When everyone else froze. She moved. She saved him, and then you tried to destroy her for it. You tried to make her disappear like she never mattered. Laura felt something crack behind her ribs. Her jaw tightened. She did not look away. The SEAL commander stepped forward and placed a manila folder on the table. His voice was the kind of quiet that made boardroom air pressure change. "Show her," he said. An interpreter opened the hospital file. His hands trembled slightly as he began to translate. It was the account from Ahmed al-Duri, the former Iraqi patient from the Denver VA, the one who'd recognized her. The one who remembered. Female Navy corpsman, senior chief rank, performed emergency surgery under direct fire, Ramadi 2006, March 15, aid station shelled. The rounds hit the structure. She did not take cover. She continued treating casualties. One round struck her left shoulder. She did not stop. She sutured the wound herself with one hand and continued treating patients for 47 minutes until medevac arrived. We all would have died. Laura's hands were trembling now, not from fear, but from the weight of 18 years of silence finally being witnessed. She wiped her hands on her scrubs and held her composure like a shield. The SEAL commander's voice rose, and it carried the weight of official record. Bronze Star with Valor. Pause. The board members' faces shifted. Purple Heart. Another pause. The room contracted around the words like a held breath. Navy Commendation Medal for Valor under fire, with Combat V. He listed each medal like a toll bell. Each one a ghost. Each one a weight she'd carried alone. Dr. Sterling's face had gone the color of old parchment. His mouth moved but no sound came out. He reached for the table to steady himself, and his hand knocked over a water glass. It shattered on the tile floor, the only sound in the room besides the hum of electricity and the thud of his own pulse probably hammering like a freight train in a tunnel. You suspended a decorated combat medic for saving a patient's life, the SEAL commander said quietly. For the crime of competence. For the crime of being better at medicine than you'll ever be. That was when the FBI agents arrived. 2 of them, credentials already out, moving like people who didn't have time for formalities. The first one was a woman with steel-gray eyes and the kind of presence that suggested she'd spent 15 years learning to read guilt the way other people read books. "Dr. Maxwell Sterling," she said. "We need to talk about your access to the hospital's personnel database. 17 times in the past week. You attempted to modify employee records and delete audit logs. That's a felony, by the way." Dr. Sterling's voice came out strangled. "I was documenting legitimate concerns about an employee. You were covering up a $2.3 million fraud scheme," the second agent said. He was older, patient, the kind of cop who'd let silence do most of the work. 18 months of inflated surgical supply orders. Cardiac stents billed at double market value. All routed through Cardiomed Supply Corporation. In exchange for which, they deposited $340,000 into your personal account. We have the bank records. We have the emails between you and their sales director. Volume incentives. Performance bonuses. They call it a provider relations fee." Dr. Sterling's hand went to his chest like he couldn't breathe. "You needed Laura Bennett to disappear because her attention to supply discrepancies threatened to expose the entire scheme," the agent continued. A decorated Navy corpsman with 18 years of military medical training. She knew what normal supply volumes looked like in a trauma unit. She knew when the numbers didn't add up. And you couldn't silence her, so you tried to destroy her. Board member Harrison had already started moving toward the door. The second FBI agent stepped into his path with the casual certainty of someone who'd done this exact thing 100 times. "Mr. Harrison, we need you to stay. Your private surgical center received 87% of Dr. Sterling's referrals over the past 3 years. Your investment portfolio includes significant cardiomed stock. We have subpoenaed your tax returns and your trading records. You're looking at conspiracy charges at minimum." The room contracted again. The gravity well of consequence suddenly made itself known. Captain Jake Webb spoke up from the back, his voice steady as a metronome. "My brother coded." His heart stopped beating. Everyone in that room froze. Senior Chief Bennett moved. "She saved his life with surgical precision he looked at Sterling, while you were more concerned with protecting a fraud scheme than saving human lives." Dr. Sterling tried to stand. The cuffs were already coming out. The FBI agent read him his rights with the practiced efficiency of someone who'd memorized the words 500 times and never needed to change a single syllable. "You have the right to remain silent." She had no authority. Dr. Sterling's voice cracked like a whip. "She's just a floor nurse. I run this department." "You ran this department," the agent corrected. Past tense. They walked him out through the emergency room, past the same nurses who'd shunned Laura in the break room, past the medication preparation room where he'd cornered her in silence, past the unit board where her fabricated write-up still hung like a scarlet letter. His voice rose to a shout, something animal and desperate, the sound of a man watching his entire architecture of lies collapse in real time. Laura watched him pass. She didn't move. She didn't flinch. One tear escaped, not from fear, not from relief, but from the pure weight of 18 years finally being acknowledged in front of witnesses. She wiped it away without breaking eye contact as Sterling disappeared around the corner, his protests fading like a siren moving away. Captain Rourke stood beside her, his presence solid as a building. He said quietly, "You never have to hide again, Senior Chief." She nodded once. Just once. It was enough. The hospital board's formal apology came 45 minutes later. Full reinstatement of privileges. Immediate restoration of her standing. An offer to establish a new veterans trauma unit under her clinical direction, funded by a coalition of military family organizations who'd read about what happened and decided that every veteran deserved to be treated by people who understood the cost of service. Laura listened to the board president explain the initiative. $50 million in endowment. A dedicated 20-bed unit. Staffing requirements that specifically recruited other combat medics and military medical personnel. A whole new approach to treating PTSD and combat-related injuries within the civilian healthcare system. She looked at the SEAL commander. She looked at his daughter Emily. She looked at Captain Webb and the 50 uniforms still standing in the hallways like a promise. "I need time to think about it," Laura said. Her voice had changed again, no longer deferential, no longer invisible. It carried the weight of a senior chief petty officer who'd already made her decision but needed 48 hours to say goodbye to the woman she'd been pretending to be. But that's a story for another day. What happened in those 48 hours, and what Laura Bennett built in the 2 years that followed, is where the real victory lived, not in Dr. Sterling's fall, but in the sanctuary she created for people like herself, people who'd bled for their country and deserved to be seen. If you've ever been underestimated by someone who didn't know your true value, hit that subscribe button. If you've ever judged someone only to find out you were dead wrong, like and comment below. And if you know a hero walking among us, someone in scrubs saving lives in the dark, tag them in the comments. They deserve to be seen too. Heroes walk among us. Sometimes in scrubs saving lives in the dark.